Hello, I am Bridget Wallace. I'm the Director of Clinical Education for Concussion Health. I'm a physical therapist and also the owner of 360 Balance and Hearing in Austin, Texas. This short presentation is an overview of 7 tests that are addressed in more detail in our ebook Performing the Clinical Exam. These tests can be performed quickly and provide valuable insight into your neurological exam, which is especially critical following any severity of head trauma. As you likely know, there has been a growing amount of attention on the importance of assessing visual and vestibular or inner ear function following head trauma. As highlighted in the following slides, you will see this goes far beyond vision and general balance. The eyes are the windows to the brain. Begin your ocular motor exam with assessing how well the eyes rest in midline, in both the horizontal and vertical planes. Alignment can be more accurately measured with tools commonly used by optometrists and/or ophthalmologists. In a study of ocular motor impairments following blast-related concussions, vertical misalignment occurred 55% of the time and horizontal 45%. Malalignment can affect ocular motor control and even cause double vision. Smooth pursuit is also known as tracking. During this test, you examine how accurately and timely the eyes follow a fixed point. This is commonly done in what is known as the H pattern. In the study mentioned previously, it was noted that pursuit impairments occurred 60% of the time following a blast-related concussion. Smooth pursuit has a high level of sensitivity to central nervous system disruption. Or saccades is how accurately and quickly the individual can look between targets. In the same study mentioned previously, saccades was impaired 30% of the time post-blast-related concussion. Saccades has a number of backup systems and is considered to have a high level of specificity to CNS dysfunction, particularly brainstem and cerebellum. Impairments in this area are more commonly observed in concussions that also have a whiplash component. Vergence is essentially eye teaming. During this test, you observe how symmetrically the eyes follow a specific target moving towards the bridge of the nose, which is convergence, or away, which is divergence. Convergence impairments have been noted in a number of studies post-head trauma, especially near-point convergence. Dysfunction increases vulnerability to suffer from headaches, eye fatigue, and decreased ability to focus. The vestibular ocular reflex, or VOR, enables us to keep things in focus while our head is moving. During this test, the examiner compares the difference between static and dynamic vision. Ideally, the individual would be able to read the same line or the line above, and without provocation of symptoms. This is done with the head moving at a frequency of about 2 Hz or 2 cycles per second. Provocation of symptoms may include dizziness, blurriness, jumping of the letters, or even nausea. The VOR is commonly disrupted post-head trauma, and symptoms are exacerbated by head movement in busy places. The VOR Cancellation or VOR suppression test assesses how well the individual can track a target when the eyes and head are moving together. Now, traditionally, this test has been known as a cerebellar test, when the examiner would look whether the eyes can perform adequate pursuit while the head and eyes are rotating together. When they cannot, the examiner will observe a corrective saccades, what looks more like a nystagmus, as they attempt to perform this test. Now, following concussion or mild head trauma, the subject can often perform this test without abnormal eye movements. However, it has been found to have a notable provocation of symptoms, and in some cases they may lose their balance if they perform this test in standing. Performing a Romberg, which is feet together, eyes closed on a firm and foam surface with the head moving, has shown to have the highest level of sensitivity to vestibular or inner ear dysfunction, more than performing balance tests without the head moving. Considering that dizziness is highly correlated to vestibular dysfunction, and dizziness has been found to be the #1 predictor of post-concussion syndrome, assessing the vestibular system in the most sensitive way is an important part of the exam. While our eyes are our windows to the brain, our inner ear is our gyroscope of where we are in space. Disruption to these symptoms is common following head trauma and can be related to a number of symptoms associated with post-concussion syndrome. For healthcare providers evaluating patients post-head trauma, an ocular motor and vestibular assessment is a critical component to the exam, not only to measure impairments in these 7 areas we just discussed, but to identify what test or test results in a provocation of symptoms. Successful treatment begins with an accurate diagnosis. That wraps up this PowerPoint presentation. If you find this information valuable, you may also find our ebook, Performing the Clinical Exam, to be a useful tool. I thank you for your time.